This is part 3, lifestyle factors. We've talked about how low-level inflammation is a key target for treatment. Here are the 4 lifestyle factors that we'll review that can cause inflammation or help prevent it. The first is physical inactivity. Inactivity can lead to loss of leg strength, inadequate load through the joints, loss of flexibility, and fat cell development. Many of these indirectly lead to inflammation. The second factor is diet. Food contributes to inflammation directly. It also contributes to metabolic conditions, our microbiome health, and weight, which we'll soon learn are important factors with inflammation. Factor 3 is sleep. Sleep can impact inflammation directly, pain, as well as energy levels. And finally, stress and thoughts. These also impact inflammation, pain, and our activity levels. Let's talk about physical activity and loading our joints. Which group tends to have stronger cartilage and bone mass? Do you think it would be astronauts or marathon runners? In a study of ultra marathon runners, about halfway through, those runners show a positive cartilage adaptation. Other studies have shown running to be a protective factor for knee cartilage. Astronauts, on the other hand, lose bone mass in space, as there's an absence of loading on their joints. This is believed to be the case because joints, bone, and cartilage can adapt to load. So sometimes even just standing and walking is bothersome. In these cases, exercise can be adapted to account for where you're at currently, and progress can still be possible. I want to point out something here about diet. This is called the omega cascade. Take a look over to the right of the screen. If you look at this diagram, you'll see 2 types of omega fatty acids, 3s and 6s. Consuming omega-6s leads down a pathway towards inflammation, whereas consuming omega-3s leads to a pathway towards anti-inflammatory processes. Remember, anti-inflammatory is what we're after. Some of you may also recognize the COX-2 enzyme that is shown in the center bottom portion of that diagram. This enzyme turns some of the omega-3s into inflammatory products. This is sometimes a target of pain medication. Perhaps consuming foods with the natural anti-inflammatory powers of omega-3s may be a better option for you than man-made medication, which may have potential side effects. Body weight is another factor to consider, which is driven by physical activity, diet, sleep, and possibly genetics. Fat cells contain leptin, which is another substance known to break down cartilage. Note that higher body mass due to lean muscle is actually a protective factor. But when that body weight is due to excessive fat, that may be problematic. Many studies show that just a 5 to 10% reduction in body weight has a significant effect on pain and function, which is irrespective of the amount of structural change present.